students. This is Menopause University, where I teach you everything you need to know in order to manage your menopause your way successfully. We have been tackling a great big unit on breast cancer. And I think it warrants a lot of attention here in this education, not because it's the beast you've been terrorized into believing it is, but because so much of what you've heard is untrue. And I want you to understand all the things that are making it so distorted. So I'm taking the time to dispel all the myths as we work our way through this unit. I've spent a lot of time schooling you on the risk factors and unlikely causes of breast cancer. Now, I'd like to address the pathology of breast cancer. In other words, what goes wrong to create it in the first place? I guess you can think of this tutorial as one that explains how your beautiful breast turns into a cancerous beast. Beauty becomes the beast. But you'll see that the beast is much more friendly than you've been led to believe. It's more like this than this. Now, pathology is the term we use to describe the process that transforms normal into abnormal. And that's just a general topic in medicine in general. Everything has pathology. So there's the normal and there's pathology. We're going to focus on pathology. If you have my book, you won't find this particular piece that I'm going to give you today in either the first or the second edition. In both editions, I delve right into breast cancer without telling you all about how it develops. But here, I'm going to start by making sure you understand how it becomes breast cancer in the first place. I will begin by saying that there are many different kinds of breast cancer. They do not all start with the same cell type. They do not all have the same personality. In some ways, it is not even possible to teach you about breast cancer pathology without focusing on one specific kind of breast cancer. So do not assume that all breast cancers are the same in terms of the pathological process that creates them in terms of detail. But the overall idea is the same. And I'm going to use the most common types of breast cancer for our discussion today. They're going to function as a template for an understanding of breast cancer pathology in general. The two types of breast cancer that I'm going to use for our discussion are invasive lobular carcinoma and invasive ductal carcinoma. In other words, I'll use cancer in your lobules and cancer in your ducts. So let's begin by reviewing the anatomy of your breasts, because you must realize that all cancers involve transformation of a normal cell into a cancer cell. I used broccoli in the very first video of this breast cancer unit to illustrate the lobules and ducts of your breast. That was video number 356. The glands that are the functional units of your breast consist of two separate parts. The lobules here are the head of this broccoli. They are the milk glands that produce milk during and after pregnancy. The ducts, on the other hand, are the stalk of this broccoli. They are the conduits through which milk travels from the lobule to reach your nipple. Now, the reason these two structures develop into different kinds of cancers is because the types of cells in the two are different. The lobule is a gland. And I've taught you that the name that describes a glandular cell is adenomatous. Glandular or adenomatous cells are spongy and thick like this. Why? Because they function in the production of milk. Milk production is a big job. So the adenomatous cells that perform that job are big and cushy. This means that the kind of cancer that develops in the lobules of your breast is an adenomatous cancer. It's a cancer of the thick, spongy glandular cells. In contrast, the ducts of your breast are just pathways for milk to travel. They have no function other than that of a conduit. So they don't need glandular tissue to perform their function. All they need is a thin, skin-like layer inside the duct. Well, I've taught you that skin cells are called squamous cells, and squamous cells are flat, and this is because they function as pavement along the walls of the ducts. This means that the kind of cancer that develops in the ducts of your breast is a squamous cell cancer. It's a cancer of the thin, flat, squamous cells. The kind of cancer a person develops depends on which of these cell types transforms from a normal cell into a cancer cell. But regardless of which cell type becomes cancerous, the basic process of transformation is the same. Now, if you've been watching my videos in order, you have seen this at least a dozen times. This represents the process of transformation for all cancers. All cancers transform from a normal cell to a hyperplastic cell, to an atypical hyperplastic cell, to a dysplastic cell, to a neoplastic cell, to carcinoma in situ, before they ever become invasive cancer. And as you can see, this normal cell up here, I'll use my pointer to point, this normal cell up here is a perfect line of cells, just one layer thick. It's perfectly organized. The very first transition is called hyperplasia. Hyperplasia is where there are too many cells. But here you can see that instead of just one row of perfectly ordered cells, there are multiple layers of perfectly ordered cells. But all the cells are still normal. There's just too many of them. But this is not cancer, not by a long shot. When it comes to your breast hyperplasia means multi-layered cells rather than single-layered cells in your lobule or your duct. It would be analogous to having extra thick soles on the bottoms of your feet from walking around barefooted a lot. And the multiple layers of cells in your breast lobule or duct would not be cancer any more than the thick skin on the soles of your feet. Hyperplastic cells in your breast are not breast cancer, and they are not associated with an increased risk of breast cancer. With hyperplasia, you still have a beautiful breast. Now, the next step in the transition from a normal cell to a cancer cell is called atypical hyperplasia. That's here. Now, atypical hyperplasia is when the multiple layers of cells start to look a bit wonky. Instead of being multi-layered and perfectly ordered, the cells are no longer in perfect order. The rows may be a little crooked, or they may be a random wonky cell here or there. And while atypical hyperplasia is still a long way from cancer, it does increase your risk for breast cancer. But at this point, you still have your beautiful breast. The next step in the process of transformation from a normal cell to a cancer cell is dysplasia. That's this whole row here. Dysplasia is when the cells are both multi-layered and disorganized. This is still not cancer. It's pre-cancer. This is the same thing that causes your cervical pap smear to be abnormal. And if you have cervical dysplasia, the treatment is freezing the dysplastic cells, lasering the dysplastic cells, or excising the dysplastic cells. I mentioned this treatment for cervical dysplasia so that you can put this into context in terms of how far it is from being cancer. Dysplasia of your cervix is something that's treated and forgotten. It's merely pre-cancer. And once again, you still have your beautiful breast. But even though dysplasia is pre-cancer, if you did not treat it, there's no guarantee it would ever become actual cancer. It may just remain as dysplasia, or it may continue transforming in an abnormal way and progress to the next step. And the next step in the pathological process is neoplasia. That's this purple row here. Neoplasia is when the individual cells exhibit characteristics of cancer cells. Now, individually, the cells are so abnormal that they no longer resemble the original cells. I mean, look how different this row looks than that. I mean, they don't look anything alike, okay? But even though there were some individual cancer cells here and there, they have not exhibited any of the behaviors typical of cancer. This means that not even neoplasia qualifies as breast cancer. So after all these pathological steps, you still have your beautiful breast. Neoplasia says nothing about the extent of spread of the neoplastic cells. It describes the degree of abnormality on the level of just a single cell rather than a group of cells. And a single cell doesn't mean much unless it begins to replicate rapidly and in an uncontrolled manner. But there's no guarantee that it will do so. This means that even neoplasia falls in the category of precancer, and your breast is still a beauty. So, both dysplasia and localized neoplasia are pre-cancer. Now, with every other bodily organ, dysplasia and neoplasia are clearly only pre-cancer, and they are treated as such, just like the example I just used of cervical dysplasia. But when it comes to breast cancer, people don't utilize the terms dysplasia or localized neoplasia. Instead, they use the term carcinoma in situ. Now, carcinoma in situ is here, right there. It looks like a toilet paper roll because it is. I'll take it off the board so I can show you some things more clearly in a minute. But in video 362, I discussed carcinoma in situ, or CIS, in detail. You learned that it is a complete oxymoron, and that's because its very name is self-contradictory. The word carcinoma means cancer, but it is not cancer. By definition, you don't have cancer until the abnormal cells invade surrounding tissues. And here, all you have is disorganized cells that are in their original location, with no invasion of anything, not even their own boundaries. But the words in situ mean in their original location. So carcinoma in situ, on the outside of the ductal gland, looks perfectly normal. All the abnormalities are in here, where they aren't going anywhere or bombarding anything or invading anything. And again, if these cells in their original location stay in their original location, they cannot be carcinoma. So carcinoma in situ is really dysplasia or localized neoplasia. As such, it is pre-cancer. But the most important thing to understand is that carcinoma in situ is not cancer. Here's a photo of carcinoma in situ in a duct, also known as ductal carcinoma in situ, or DCIS. As you can see, the cells are piled up inside the duct, but the duct is intact. There is no disruption of the duct wall, and there are no abnormal cells outside the duct wall. Here's an analogy. Here I have an anatomic model of a heart artery. Now, this model consists of 4 degrees of progression of plaque buildup inside the artery. This first one is completely normal. Can you see that? Totally normal. I'll look right through it at you, okay? So it corresponds to a breast duct that does not contain any abnormal cells at all. This second artery has just the very, very, very beginning of plaque buildup. I'm going to bet you can't even see it. There's a tiny, tiny little swelling here. It looks like a little elevated area, but it's so little you can hardly see it. It's just beginning to happen. This third artery shows a more obvious degree of plaque buildup. Can you see it down here? And it's a great analogy for carcinoma in situ of your breast, because notice that the buildup of cells is entirely within the artery. The outside is perfectly normal. The wall of the artery is completely normal. And the exterior of the artery looks the same. It's totally normal. This is exactly how carcinoma in situ looks. The key is that it is localized. It hasn't gone anywhere, and it hasn't disrupted any nearby anatomy. Now, this buildup of abnormal plaque may just stay that way. Alternatively, it may progress. If it stays this way, you do not have a heart attack. If it continues to build up and completely clogs the artery like this, then you do have a heart attack. So this fourth artery shows near total occlusion of the artery. This is what would qualify for having a heart attack. This would result in a heart attack. With carcinoma in situ, we're not talking about occlusion of a blood vessel. Instead, we're talking about self-containment of abnormal cells. If those abnormal cells do nothing more abnormal than they've done already, it's just pre-cancer. It may or may not ever become cancer. Here's another analogy. Think about the effect of sun on your skin. If you get a lot of sun exposure, it damages your skin cells. And that damage can either heal or it can progress. If you just get a sunburn that resolves, then it healed. If you get melanoma, it progressed. The sunburn, while a result of damaged skin, was not the same thing as cancer. So despite all the pathological changes I've delineated thus far, your beautiful breast has still not yet become a cancerous beast, and it may never do so, even with carcinoma in situ. When or if the cancer cells replicate enough times to outnumber and overtake the surrounding normal cells, then it becomes a true cancer, and it begins to grow beyond the borders of its original location. This is called invasion. So invasion looks like this. In this toilet paper roll, look, there's abnormal cells on the inside, but they've come out here and invaded the outside too. Invasion is when a group of neoplastic cells penetrate the border of the anatomical site where they reside, and they begin to encroach on neighboring structures. This is when a cancer becomes a cancer. Until cancer cells invade other structures, they are self-contained. As long as they are self-contained, they can be treated by simple excision. It is only when they become invasive that they pose the risks that you associate with cancer. Here's a photo of invasive carcinoma in a duct, also known as invasive ductal cancer. Invasive cancer is what constitutes the beast. Here. So you see that pathology is a process. It is not something that happens all of a sudden. It is not something that goes from normal to cancer in one step. It consists of a series of steps on the level of individual cells in addition to a series of steps on the level of groups of cells. You don't have cancer until you have a group of neoplastic cells that invade surrounding tissues. Here's a photo of all these steps. If you look at the largest circle, it represents a completely normal duct. All the cells are perfectly aligned in one layer. The first smaller circle just below represents hyperplasia. So instead of just one layer of cells, there is an area with multiple layers of cells, but all the cells are still normal. The circle to the right of that one is atypical hyperplasia. Now you have some cells that look a bit wonky, but it is still not cancer, and it may never become cancer. After that, you have carcinoma in situ. Now the cells are neoplastic, meaning that individual cells show disorganization representing cancer, and there are multiple layers of cancer cells. But they are still in their original location in the duct. They have not yet behaved like cancer, and they may never behave like cancer. They may just stay like this for the rest of your life. And the last circle finally shows development of invasive cancer. Now you see that the abnormal cells are spreading beyond the boundary of the duct itself. They have invaded the duct wall. This is what makes it cancer. If we make a little chart reflecting these steps in the pathology of breast cancer, it looks like this. The chart lists the classification of each step of progressive pathology in the first column. Then it designates the name of each in the second column. And it provides the description or characteristics of each in the third column. And you can see that I've just listed all the steps I took you through today and described each one in the last column. It's simple, but it gives you the overall idea. If you want this chart, you can find it in the description box below this screen or at menopausetailor.me. So what you have learned here today is that cancer is always a series of steps that involve progressive levels of pathology, including normal cells in a single organized layer. Hyperplasia, which is normal cells in multiple organized layers. Atypical hyperplasia, which is slightly abnormal cells in multiple layers. Dysplasia, which is abnormal cells in multiple disorganized layers. Neoplasia, which is very abnormal cells with characteristics of cancer cells in multiple disorganized layers. Carcinoma in situ, which is a group or cluster of cancer cells that is localized to its place of origin. And invasive carcinoma, which is a group of cancer cells that has invaded through the boundaries of its place of origin. This series of events takes years. Typically, a breast cancer that we diagnose today began this process 7 to 10 years before. So it takes a lot of time for your beautiful breast to become a cancerous beast. I've shown you this a bunch of times too. It represents the division and replication of a single cancer cell. And every cancer cell begins with a single cell that goes crazy and replicates in an uncontrolled manner. And understand that this begins only after that first cell is an actual cancer cell. One cancer cell becomes two, two cancer cells become four, etc. So this progression through the successive steps of abnormality constitute the pathology of what transforms normal breast tissue into cancerous breast tissue. I think it's appropriate to say that because the process is slow, breast cancer is not a fierce beast like this. Instead, it's a more gentle beast like this. The fear of breast cancer is definitely a bigger beast than the actual disease. I hope this has helped you to understand breast cancer pathology a bit better. Every video brings you a little closer to full understanding, and this is what a real education is all about. So that's it for today. Next week, we'll talk about what induces abnormal cells to progress into cancer cells. In other words, what are the triggers and what are the barriers? If you want a consultation for any reason whatsoever, you can schedule it at menopausetailor.me. I do all of them by video conferencing, so it doesn't matter where you live. If you want to subscribe to my newsletter or to Menopause University here on YouTube, you can do that right now. And if you just want to see what I'm up to, you can follow me on Facebook, Instagram, Pinterest, and Stories. If you follow me on social media, you'll probably discover that I'm really boring. You'll get tidbits about my personal life, but it's mostly about menopause because my channel is not about me. It's about you and your menopause. I am merely the vessel for your education. So come back in a week and I will see you then. Bye.